Good morning, everyone. And again, my sincere apologies for not being able to be there in person with you today. I wanted to share with all of you a very brief presentation on the new Global AIDS Strategy, a framework for the HIV response going forward to 2031. I hope this sets a starting point for further reflection today on where the response in India needs to go over the next 5 years. India, after all, has the second largest population of people living with HIV globally, so we are definitely not going to achieve the goal of ending AIDS as a public health threat if India doesn't get there as well. Why are we here and why does it still matter? I think we would all agree in a world consumed with conflict at the moment, from the Middle East to the Ukraine, Sudan, and so on, we can see crises, human rights erosions, political uncertainty, and some are quietly asking whether ending AIDS is still possible, whether it's still realistic, whether it is still a priority. And of course, our answer collectively must be clear and courageous. Yes, ending AIDS is still possible, but only it will be possible if we don't give up. That's why we need a strategy, not because the world is calm, but because the world is turbulent. This is not a UNAIDS strategy. This is a strategy uniting the world. It's a roadmap showing that what it will take to end AIDS as a public health threat. Why now? We are at a historic crossroads. The science exists, the tool exists. Communities have never been more resolved. But political will and financing are fragile, and the window could close. This moment may be our lost opportunity to align the global momentum and end AIDS once and for all. This strategy is not about maintaining systems, it's about transforming them. It's not about incremental change, it is about decisive action, and it calls on all of us, governments, donors, civil society, communities, and leaders, to choose courage over fatigue and hope over resignation. Now, the strategy was not developed behind closed doors. It was shaped by thousands of voices across regions, identities, sectors, and experiences. It came from people living with HIV, young people, key populations, governments, donors, researchers, parliamentarians, and UN partners alike. Through surveys, regional dialogues, virtual consultations, and deep lived experience conversations. If we look at the diagram on the screen, in Asia Pacific alone, we held consultations which involved 96 civil society organizations and 18 governments, often just representatives from governments, in those consultations. Now, the strategy was actually built on 4 building blocks. First of all, we undertook a midterm review of the previous global strategy, and that was reported as our global report back in July 2027, where we gave a progress update on where the strategy was and what was needed to go forward. We also undertook a process where we looked at what the recommended global AIDS targets would be required for 2030, 2031. And a special working group was built 18 months ago to look at those and develop them. And then we also drew on a number of countries who are developing sustainability roadmaps. And we used those as the foundation for developing a great theme along sustainability in the strategy. And you'll also see, of course, that we've had a number of consultations throughout countries and regionally as well. So what's new? The new Global AIDS Strategy is not business as usual. It responds to the world we are now in, a world of overlapping crises, widening inequalities, shrinking civil space, and new health and economic shocks. What is new is not only the framing, but the level of ambition. We have a sharper focus on inequalities, structural barriers, and people who are most left behind. A deeper commitment to human rights, gender equality, and decriminalisation. Stronger commitment to communities as leaders and decision shapers, and a better integration with broader health and development agendas, including universal health coverage and preparedness for future crises. Clearer lines of accountability, who must do what, by when, and with which resources. In short, this strategy is designed not just to sustain progress, but to close the gaps that are still costing lives. Now, the strategy sets out three priorities centered on ending AIDS and ending inequalities. Priority one, sustaining the response. This is mapping out a country-led response that is resilient and ready for the future for people living with and affected by or at risk of HIV. Priority two are people-focused services. Equity, dignity, and access for people living with, at risk of, and affected by HIV. And priority three is around community leadership at all levels of the strategy, from financing and integration through delivery of services and accountability. The Global AIDS strategy aims to be more focused and prioritised. Last time, I think we covered around 15 areas for action. This time, we're putting forward 8 result areas across those 3 priority areas that I just outlined in the previous slide. Throughout the result areas, from financing to HIV prevention, you'll find actions that aim to build sustainability of the response, ensure full community engagement, and strengthen country systems and health security. Let me, over the next several slides, take a deep dive into the 8 result areas. Now, I'll not go through all of the detail that are on the slides. I'll let you read those and maybe consult them at a later time. Here, starting with priority 1, the action area focuses on financing, systems integration, and data across 3 result areas. Now, result area 1 focuses on financing and the response to HIV. And it's essential for national strategic plans to be integrated within national structures for a coherent national response. Funding sources need to be diversified, especially domestic financing, and country-led responses should not result in increased user fees that might drive people away from services. Sustainability roadmaps will be critical and must involve communities. Result area 2 focuses on integration of HIV response into the national systems, particularly into primary health, as a clear priority. This involves investing in capacity building of health services. It also involves embedding a human rights-based approach to the integration of HIV services with stigma-free, gender transformative and youth response and key population appropriate services. Result area 3 focuses on strong data and information systems. These need to incorporate multiple sources to inform national responses, and community-led monitoring will be essential to measure the quality of those services and strengthen accountability. Under priority 2, the recommendations focus on the scale-up of essential HIV prevention, testing, treatment, and care services, but also on how to improve delivery. So here, result area 4 highlights the critical need to seize the opportunities of new HIV prevention and treatment options, like PrEP and long-acting formulations, quality diagnostics, and embedding services within communities through differentiated service delivery at all levels. Result Area 5 focuses on HIV testing and recommends the acceleration and design and scale up of people-centered services that integrate HIV services with those of other co-infections and other infectious diseases. Sexual and reproductive health, STIs, cervical cancer, maternal and child health, NCDs, chronic diseases, mental health, and gender-based violence. It highlights the critical role of networks of people living with, affected by, and at risk of HIV to help design and implement programs that meet the needs of those who need them most. Result Area 6 highlights that we cannot achieve our goals without lifting societal barriers and improving access to innovation. So this really focuses on multisectoral action, which is needed more than ever to ensure that all people can receive stigma and discrimination-free services and to lift criminalising laws. The strategy puts forward concrete actions to ensure that services reach the people who need them most. Result Area 7 emphasises the importance of improving equitable access to medicines and innovations and to leverage digital health. Priority 3, we look at Result Area 8, which proposes on how to better integrate community-led systems into national responses while promoting the key role of communities for leadership, service delivery, and accountability, ensuring mechanisms for social contracting and monitoring the funding for communities are part of the concrete actions that can ensure this is translated into reality. Apologies, I know this is a very busy slide, but for those interested in global targets, it is an essential one. The actions recommended in the strategy are aimed at enabling countries to achieve the 16 top-line targets towards ending AIDS as a public health threat by 2030. And some of these targets are new. The consolidated HIV prevention targets, the integration and the financing targets have all been refreshed and are new, whereas some of them have been actually extended. So you will see, again, the 95, 95, 95 that takes us through the treatment cascade, the 10, 10, 10 targets on the enabling environment, and the 30, 80, 60 targets on community engagement and leadership in service provision. These are all refreshed and continued as they were not achieved in 2025. Now, our governance board asked us to also provide some regional specificity. And through regional and country consultations, 8 regional chapters are included. Now, these highlight the differences in regional epidemic and financial contexts, but also how the global AIDS strategy is relevant and can be taken forward in every region. As you can see here, the Asia Pacific region has the second largest epidemic globally, largely driven by new HIV acquisitions among key populations. It's also very advanced when it comes to sustainability and integration of services. Some of the priorities for the future include a strong focus on HIV prevention for people most at risk and young people. Now, I'm not going to go through the other 7 regions, but we'll leave the slides for anyone interested to access later. And finally, a reminder on our role through consultation with governments and communities in shepherding the following process forward over the past 2 years, and more importantly, the focus this year. This has been done through a four-pronged approach, beginning with the global AIDS target setting 18 months to 2 years ago, which has now been translated into a strategy that I've just presented today. But critically, this year, we have a real big task ahead of us because we need to take this strategy now to a high-level meeting at the UN and seek a political declaration, a process that we hope will be undertaken in June at a UN special session of the General Assembly, and then the development of a political declaration which will hold member states to account and will help shape the respective national strategies and plans at country level. UNAIDS works together with countries and communities to monitor the targets. This is the UN's responsibility and promise to those living with and affected by HIV. So thank you. I'm sure that's enough from me on this morning. I hope this sets the scene for some discussion on where India now needs to go through its own national response and the uptake of critical innovations to assure it can also meet those 2030 targets. Thank you again. I look forward to the discussion as we move forward.